Good morning, everyone. I have so many things to share, and I just don't know where to begin. And this video might be a little bit out of sync from my brain and the things I want to systematically share. I was doing some research and came across an article that kind of brings the reasons why my mission is helping the consumer make sure that everything is before you as far as your options on paying for your health care before you need to. Of course, I can't address emergency things, but things that are planned, things that are coming up, a lot of things we can save on the road to having our health care taken care of. So I ran across an article, and it's dated October 5th, and it says, United Healthcare and Anthem behind on billions of payments to hospitals. Being one of the largest payers and being in the business that they're in and all of their diversity, I think is extremely sad. And the article goes on to say that it is blaming it on new reimbursement rules, claims issues, and retroactive claim denials. They talk about Richmond, Virginia, and the University Health alleges that Anthem owes the provider $385 million. That's crazy. That's a lot of money. Now, there's a few factors that I can think of and can imagine why that number is so high, but we won't go there. 40% of the payments are more than 90 days old, violating state law dictating that insurers must pay claims within 40 days. The American Hospital Association told this reporter that complaints span across the country. Between June 30th of 2019 and June 30th of 2021. Anthem's, now this is a Blue Cross payer, or Blue Cross Blue Shield, unpaid claims rose to 43% to 53%, accounting for $2.5 billion. United Health unpaid claims have remained at 54% over the past 2 years, according to this report. Anthem delays payments through new paperwork requirements and prior authorization or requests to speak to doctors directly. And there's a lot of different reasons that they do what's called a peer-to-peer review, and but I just can't imagine why the delays are so great. The other thing that they're touting is it's also creating hurdles that are encouraging patients to use facilities that the payer owns. Anthem said many of these steps are taken to control excessive prices from the hospital. Yeah, because they want to keep their money in their pockets, which, to a point is understandable. But on the other hand, I'm not a fan of insurances owning their own facilities. Patient complaints that United Healthcare denied payments due to lack of documentation of medical necessity or delayed payments due to prior authorization system outages, according to the report. So in other words, they're claiming lack of payment, or lack of documentation, which that happens quite often and fairly common. The medical necessity thing, that gets a little sketchy in my book sometimes. For an example, I know of a nurse practitioner that I was talking with, and it was a matter of, sometimes there might be something that they're pretty sure that the diagnosis is going to be this. And a lot of times the algorithm is you get one study done before you get to do another one. But, in medicine, we look at it and go, it's going to be this. Why do we have to have this one test done if we know pretty much feel that it's going to be this diagnosis, and we're going to end up turning around and having that patient have another study done. I mean, that's one of the puzzle pieces that is frustrating, that insurances are driving, and CMS are driving how healthcare is done, and it's really kind of a frustrating note. So the insurers told this reporter that facilities may appeal claim decisions and that the July prior authorization damage was resolved quickly. Again, some of these prior authorizations, and I've witnessed it. I've been in, I've worked on a system recently that, looking at the notes of getting a prior authorization for something, the case manager will put a note going, waiting for the date of service. Well, if you stream down, invariably that information is there, and it's just so many delays and ridiculous reasons for delaying care. Which leads me to another article I read. Now, this one's a little bit older. It's from May, and it's talking about how prior authorization tools can lead to 27% cost savings in the Medicare Advantage program. Now, that's for Medicare, and so what this is saying is that there's an automated prior authorization, which was built into the tool I was mentioning to you. That there, a lot of things can be auto-certed, which again leads to my why do we even sometimes have to go through that motion. A lot of it's trying to curtail the expense of having studies done unnecessarily, which I totally understand. But there's got to be a better way to figure things out. So this is talking about, they did a study from April to December of 2020. And it's 279 prior authorization requests were submitted by an unnamed large health system through this platform. And 83% of those submissions were approved in real time. So, according to the normal standards. To streamline the case management process, and this was for some cancer treatment. Ultimately, none of the submissions were denied, as researchers said the remaining 17% were reviewed through a partnership with the National Comprehensive Cancer Network. The study found Medicare Advantage patients with non-small lung cancer whose care regimens adhered to the National Comprehensive Cancer Network's guidelines experienced significant cost savings, which is a great thing. But I think what this so it cut patient care down from 19,000 to 26, or from 26,000 to 19,000. Regarding, meeting the guidelines. So there are some advantages to automation, but there's also some disadvantages to automation, which leads me to, I think back to the first article when it talks about documentation. I'm like, we have all these electronic medical records that can be very painful to use, and nurses all across the country are just, there's certain issues related to actually putting in documentations, and doctors also feel the same. There's so many layers that they have to get in just to get their documentation completed. So it's really kind of a sad kind of circle we live in, a revolving door, so to speak, in how healthcare is delivered, which drives me back to simplifying the process and making things quite easier, and having the consumer control their money, because long and short of it, depending on how certain facilities are sitting around waiting for their money, they have to keep their doors open. So who are they going to go after for their money? The patient. And some are a lot worse than others as far as, you end up with the whole thing. And if they keep breaking their prior authorization and their medical necessity and all of that, you may have gone through those hoops, you may have gotten authorization, but at the end of the day, they can turn around and say, well, they caused delays for various reasons to keep that money in their pocket. And it's really sad. So this is just kind of one of those things that I can't stress enough, that we want to, no matter what your perspective is, I can tell you that we as a consumer are status quo in, we have insurance, here's my insurance, and it's not years and years and years ago. I had a ER doc that kind of used the term Magic Kingdom card, and if you've been to Disneyland enough, the old Magic Kingdom card was your pass to all the rides, but there's a lot of truth to that. We're just accustomed. I have insurance. Insurance is going to take care of it, and yeah, some of us realize that our insurance isn't taking care of it like it used to. There are so many better alternatives that you need to stick around and find out more about. On that note, have a great day and look forward to talking to you again soon.